we welcome Dr. Bob McKinstry, Chief of Radiology at St. Louis Children's Hospital. Doctor, good morning and welcome to KFUO Radio.
Good morning.
We're going to get a brief look at Radiology 101 this morning, huh?
Yeah, I think so. We're going to give it a try.
What is the difference between the different ways of looking inside the human body?
Sure. We use X-rays either to produce what you'd normally think of as a chest X-ray or something like that, or at a much higher dose, a CT scan. And those use ionizing radiation, and those have negative biological effects, most notably carries a risk of cancer. Then we use sound waves with ultrasound to make pictures by bouncing the sound waves off structures in the body, and that has essentially no risk in routine use. And then we use MRI, which uses a big magnet and radio waves. And again, that carries a very little risk. There's really no risk of cancer from that. It's a little bit of tissue heating, and that's about it. If you're awake, there's really no risk from MRI. So the one we worry about the most is when we use ionizing radiation through X-rays and CAT scans.
And you say in an article that I recently read that children are not little adults when it comes to peering into the human body. That's
correct. You need specific expertise, and that's why we have a specialty of pediatric radiology, and we specialize within that even, and I'm a pediatric neuroradiologist, so I study the brain and spine of children. And then they also aren't the same with respect of how the effects of ionizing radiation act on the body. They have longer to live, so they have more time to develop cancer should they be exposed. And because their bodies are growing and their cells are dividing, that makes them more susceptible to cancer and therefore an additional risk. So we take extra precautions in children when using ionizing radiation.
Do kids find this experience stressful?
Yes. We here at St. Louis Children's Hospital recognize that. We have a child life specialist within our department who specializes in helping children through that and families through that difficult process. We have experts in pediatric anesthesia for those children who can't be awake during the procedure, and we have child life specialists to help us during the procedure when they are awake.
You described the various ways of looking at things inside the body. And ultrasound reminds me of when my daughter was in the womb. We got the ultrasound test. You say there's very little, if no, risk to that.
Right. Exactly. I for the purposes of our listeners, I would say there's no risk. The tissues move around, they vibrate just a little bit. You could hypothesize how those vibrations might cause a little tissue injury, but not at the levels that we use for diagnostic imaging.
Are we approaching a time when X-ray imaging and CT scans may become obsolete?
Obsolete, no. They still have a role. If you break your arm, you need an X-ray, right? If you have cancer, you probably need a CT. But what we are using is ultrasound and MRI to reduce the amount of ionizing radiation children get. Here at Children's Hospital, we've decreased the number of CT scans since 2005 in half. So last year we did fewer than half the number we did in 2005. And that translates into much less risk, and you could actually estimate that we've reduced the amount of cancer that children get as a result of making the diagnosis.
And from what I see here, you try to make the procedure as kid-friendly as possible. You've even got an aquarium in the waiting room to soothe them and calm them down.
Exactly. Our experience is definitely family-centered and child-centered, and we try to make it as welcoming as we can. I mean, the children are sick and they need our help, but we can help them through that by giving them a child-centric experience.
And perhaps, doctor, in your experience, some of the parents are even more nervous about the procedure than the children.
Oh, sure. Children are innocent. They don't know what they're getting into. The parents, I think, have much more on their minds when they come to the hospital with their child.
Yeah, whenever I've had an X-ray, the technician is behind some kind of a panel away from everything. When I'm at the dentist's office, we put on one of these bibs, if you will, metal protecting, I guess, device, and then the technician goes out of the room, is somewhere else. It makes you feel like it's dangerous. I guess because these people are working with this stuff all day, they have to take precautions.
That's right. Before we had safety measures in place for medical workers, the risk of cancer in medical workers, this is now before the 1940s or so, was quite high. And then when we realized that, increasing the distance to the radiation source or put it leaded glass or wearing lead reduce the exposure to ionizing radiation, we essentially don't see an increased risk of cancer in those performing the tests anymore. And you hopefully are not getting a whole lot of radiation. If you have a disease like cancer where we need to look and see where the cancer is, you might be getting those tests. But in general, most people, they get a dental X-ray, like you say, or they might break their toe and get an X-ray. That's really not the problem. We try to limit the radiation during those tests, but you're getting so few of those over your lifetime. It's nothing like a medical worker who would be exposed perhaps 10 times a day or 20 times a day.
Now, are these child-sized protocols used at your hospital? Is that unique?
Well, I think we are the leaders in developing and disseminating those. We're certainly taking the lead here in our region, disseminating those protocols throughout the BJC healthcare system. We really want to make sure that what we learn here about dose reduction at St. Louis Children's Hospital makes it as far out in the community as possible. We do community outreach to non-BJC hospitals, trying to educate them, because unfortunately, even though we do many of the procedures that are done in the area, CT is one that's a little tricky. It's done a lot in the community hospitals. About 2/3 of CT is performed in community hospitals. And if you go to a community hospital and they're not aware of child-size protocols, you could get an adult dose, which has a much higher risk when you're a child. So we're trying to educate the community, and we're leading the way by having the latest equipment and child-size protocols here at St. Louis.
Well, thank you for raising our awareness about the issue. Dr. Bob McKinstry, Chief of Radiology at St. Louis Children's Hospital on KFUO Radio. Have a good day. No day off for you today, huh?
No, sir. Thank you very much.
Bye, Doc.